Hello, this is Kishoran studying in Janssen Institute of Technology, first year, Artificial Intelligence and Data Science Department. Now, I would like to explain my topic of case study in physics, defects of UV rays. Introduction. UV is a form of electromagnetic radiation with wavelengths from 10 nanometer to 400 nanometer, shorter than the visible light and longer than the X-rays. UV radiation is present in sunlight and constitutes of 10% of the whole electromagnetic radiation output from the sun. Introduction to the defects of UV rays. UV radiation is released by sun or artificial sources such as tanning beds and sun lamps. This fact sheet provides an overview of major health problems linked to overexposure of UV rays. Since the benefit of sunlight cannot be separated from its damaging effects, it is important to understand the risk of overexposure and take simple precautions to protect yourself. Problem analysis. Harmful effects of UV radiation on eye, harmful effects of UV radiation on skin, premature aging and other skin damages, and immune suppression. Harmful effects of UV radiation on eyes. Cataracts. Cataracts are a form of eye damage in which loss of transparency in lens of the eye cloud vision. Harmful effects of UV radiation on eyes. Skin cancer around the eyelids. Basal cell carcinoma is most common type of skin cancer to affect the eyelids. In most cases, lesion occurs on the lower lid, but they can occur anywhere on the eyelids, in the corner of the eyes, under the eyebrows, or on the adjacent areas of the face. Age related macular degeneration. AMD is a disease that affects a macula, the part of the eye that lets you to see details. Indicators of macular degeneration include blurred central vision, trouble recognizing faces, and need for more light when reading. Snow blindness. This temporary less severe disorder results from overexposure of UV rays while at the beach or at the snow. Melanoma. Melanoma, the most serious form of skin cancer, is one of the most common cancers among the adolescents and the young age of 15 to 29. While melanoma accounts for about 3% of the skin cancer causes, it causes more than 75% of the skin cancer deaths. Non-melanoma disease, skin cancers. Non-melanoma skin cancers are less deadly than melanomas. Nevertheless, they can spread if left untreated, causing disinfection and more serious health problems. There are two primary types of non-melanoma cancers: basal cell and squamous cell carcinomas. If caught and treated early, these two cancers are rarely fatal. Premature aging. Corneal exposure of the sun also causes premature aging, which over time can make the skin become thick, wrinkled, and leathery. Since it occurs gradually, often manifesting itself many years after the majority of persons' sun exposure. Premature aging is often regarded as an unavoidable normal part of growing old. Immune suppression. Scientists have found that overexposure to UV rays may suppress proper functioning of the body immune system and the skin natural defenses. For example, the skin normally mounts a defense against foreign invaders such as the cancers and infections, but overexposure to UV rays can weaken the immune suppression, reducing the skin's ability to protect against the invaders. Problem solution. Prevention. Do not burn. Overexposure to the sun is the most preventable risk factor from skin cancer. Seek shade and limit your time outdoors, especially between 10 am to 4 pm when the UV radiation is more intense. Cover as much skin as possible with a wide brim hat and tightly woven cloth. Use sunscreen as the SPF at least 15 that blocks rays on overall skin. Check the UV index, a daily forecast of amount of UV radiation to reach the Earth's surface. Stay away from tanning booths and sun lamps. Methodology. Signs of skin cancer. Check your entire body from the top of your head and scalps and soles to your feet. Once a month using full length and hand mirrors. Learn is not learn what is normal on your body so that you will notice any changes. Who is at risk? Everyone, regardless of their coloring, is at risk of eye damage from the UV radiation. People with fair skin that burns and freckles easily, with blue or green eyes and blonde or red hair have greater risk of developing skin cancer. People with families history of skin cancer or who have experienced severe sunburn in past and people who have large number of moles are more likely to have skin cancer. Some medications such as certain antibiotics, histamines and herbal preparation increase sensitivity of the skin and the eyes of UV radiation. Check with your healthcare provider to see if medications you take increase sensitivity to sunlight. Conclusion. With the above observation, we are able to understand that UV rays cause several health issues. Many of these issues are very impactful in our lives. As well as exposed to UV rays on a daily basis, we must also follow the solution are suggested above and take good care of ourselves. Then if we also try to avoid other activities that causes ozone layer depletion, we could create a better world. Thank you.